Health Secretary Matt Hancock has offered a full apology to women affected by 3 medical treatments that may have harmed them and their babies. A highly critical review found that officials failed to listen to concerns about the pregnancy test Primodos, the epilepsy drug sodium valproate, and pelvic mesh implants. It comes after decades of campaigning by the families affected, including some here in the northwest. Here's our health correspondent, Jill Dunnigan.
For the past 17 years, Faith Scott struggled with poor health, joint problems, cleft palate, severe curvature of the spine, and a mental age of around 3.
So that meant personal care, nappy changing, toilet changing, dressing. I'm tired and exhausted of having to continuously look after a 3-year-old, and it doesn't get any easier.
When Samantha was pregnant, she was taking a drug called sodium valproate for her epilepsy, one of 3 treatments featured in today's review, which also looked at an internal surgical mesh and another drug, Primodos, used as a pregnancy test.
We've been constantly pushed away.
For 40 years, Mary Lyons campaigned for answers after her daughter Sarah was born with one arm. She took Primodos in 1970. 3 years after today's report concludes it should have been withdrawn as a pregnancy test because of concerns about links to birth defects, a claim the manufacturer has always strenuously rejected. This report makes for uncomfortable reading. It describes systemic failings in the way the health system dealt with patient safety concerns, a culture of dismissive and arrogant attitudes towards those concerns raised mainly by women, which allowed them to be labelled as attributable to women's problems. The review team was led by the former Health Minister Baroness Julia Cumberledge.
We have never encountered anything like this. The intensity of the suffering, the fact that these conditions lasted for decades.
Among the recommendations, the setting up of an independent patient safety commissioner and an agency to resolve future disputes, along with a discretionary payment scheme for those who've been affected by these treatments.
I want something set up for her when I'm not here. So I want to make sure she's not neglected when she's an adult. I want her to be in a nice residential home when she's old, because she will need to be in a residential home.
Mary, meanwhile, wants the whole health profession to take note of the findings.
If a woman actually says there is something wrong, there is something wrong. It's not the time of life or, in your head or, don't be silly, that doesn't exist, there's no association. There is a reason that women actually speak out.
Jill Dunnigan, BBC Northwest Tonight.